Hello, my name is Gina Ziegler and I am a registered nurse. Today I will be presenting my Capstone project, which focuses on developing a standardized perioperative nurse competency checklist to support preceptor-led orientation. This project focuses on developing a standardized perioperative nurse competency validation checklist to support preceptor-led orientation. The checklist provides an evidence based, structured approach for preceptors to consistently teach, assess, and validate essential clinical skills during orientation. Standardizing the process helps minimize training inconsistencies, boosts preceptor confidence, and ensures that new nurses achieve competency in essential perioperative skills. The checklist is integrated into the orientation workflow and is supported by feedback from preceptors and nurse leaders to enhance usability and effectiveness. At my selected hospital, perioperative nurse orientation is guided by experienced preceptors, providing valuable hands-on teaching and mentorship. Although this approach is effective, differences in teaching and evaluation methods create an opportunity to increase consistency and ensure all new nurses achieve standardized competency benchmarks. Creating a structured, evidence based perioperative competency checklist helps preceptors provide consistent training and ensures new nurses develop the skills needed for safe, high quality patient care during orientation. The principal stakeholders in this project include preceptors, nurse leaders, and organizational educators. Preceptors guide new nurses through orientation and use the competency checklist to teach and evaluate skills. Nurse leaders guide the process and help integrate the checklist into daily orientation while keeping it aligned with organizational goals. Organizational educators provide guidance on curriculum, skills validation, and compliance while helping to shape the project. Together, all stakeholders offer feedback and support that will ensure the project is successful and sustainable. For this project, I used the Donabedian structure process outcome model as the guiding framework to support the development and implementation of a standardized perioperative competency validation checklist. This model focuses on three key areas, which are structure, process, and outcomes. Structure includes the orientation program, trained preceptors, and competency tools. Process refers to how consistently preceptors use the checklist to teach and evaluate skills. Outcomes reflect how well nurses are prepared for independent practice and how consistent the orientation experience is. Applying this framework provides a clear and organized approach to improving orientation quality while ensuring that perioperative nurses are properly trained, competency is validated in a standardized way, and patient safety is consistently supported. The evidence supporting this project highlights the benefits of a structured, evidence-based tool for preceptors during nurse orientation. Checklists help ensure consistent orientation and complete coverage of essential tasks, while structured competency tools boost preceptor confidence and support accurate evaluation of new nurses. Using an evidence-based curriculum along with ongoing support helps preceptors teach more effectively and keep staff engaged, while having clear role expectations makes mentorship smoother and helps new nurses settle into their roles more confidently. Overall, these findings show that a perioperative competency checklist can help preceptors run orientation more smoothly, keep training consistent, and make sure new nurses are prepared to provide safe, high-quality care. During this project, leadership strategies focused on collaboration, clear communication, and mentorship. Preceptors and nurse leaders were involved in planning and refining the competency checklist, and regular coaching and feedback helped ensure consistent use. The checklist was integrated into orientation, outcomes were tracked, and feedback was used to make ongoing improvements, which supports a culture of safety and continuous learning. This approach helped build a supportive learning environment, encouraged accountability, and kept patient safety as the main focus throughout orientation. This project aimed to achieve three key outcomes. First, to standardize orientation and competency evaluation by fully integrating the perioperative checklist into the orientation process, with at least 90% of preceptors using it by week 14 to ensure consistent training and evaluation. Second, to enhance preceptor competency by ensuring at least 85% of nurses demonstrate proficiency in all critical perioperative skills, giving preceptors confidence and readiness to guide new nurses. And third, to improve workflow and usability by gathering feedback from preceptors and nurse leaders, applying recommendations to the orientation process, and ensuring that at least 85% of preceptors find the checklist clear, practical, and easy to use. The outcomes of this project will be evaluated using several key criteria. Checklist adoption is measured by the percentage of preceptors consistently using the tool during orientation. Preceptor competency is assessed through surveys and observations to ensure nurses demonstrate proficiency in all critical perioperative skills. Workflow and usability are evaluated through preceptor and nurse leader feedback on clarity, practicality, and effectiveness. Essentially, success is achieved when adoption and competency targets are met, and most preceptors report the checklist is an effective and practical tool. The outcomes of this project were successfully achieved and certainly had a meaningful impact on the organization. The standardized perioperative competency checklist reached over 90% adoption amongst preceptors, which supports a more consistent and structured orientation process. In addition, at least 85% of the orientees achieved proficiency in essential perioperative skills, while more than 88% of preceptors reported improved confidence in their ability to teach and evaluate new nurses. Preceptor feedback also indicated that the checklist was clear, practical, and improved workflow during orientation. Overall, this project improved consistency in training, strengthened preceptor effectiveness, and supported safe, high-quality patient care while also establishing a sustainable framework for ongoing staff development and regulatory readiness. Nursing judgment is essential for achieving desired outcomes and supporting patient-centered care. It continuously directs decisions that are evidence-based, timely, and customized to each patient's unique needs. By carefully assessing patients, thinking critically, and drawing on their clinical experiences, nurses can anticipate possible problems, decide which interventions are most important, and adapt care and plans to keep patients safe and ensure quality care. In terms of this project, nursing judgment recognized gaps in new nurses' perioperative skills during orientation and provided focused, evidence-based teaching to address them. By applying informed judgment while using the standardized competency checklist, preceptors were able to validate skills consistently, reinforce best practices, and guide new nurses towards achieving proficiency. This approach strengthened orientation and helped develop confident, competent perioperative nurses, ensuring patients experience safe and effective care. This project is significant to nursing because it reinforces the importance of a structured, evidence-based orientation and competency validation in developing highly skilled perioperative nurses. Utilizing a standardized checklist for preceptor-led training helps preceptors teach consistently, assess skills accurately, and evaluate new nurses reliably. By strengthening clinical competence, increasing preceptor confidence, and focusing on patient safety, this approach promotes excellence in nursing practice. This project provides a lasting framework for staff development and regulatory compliance, highlighting how thoughtful leadership and evidence based practices strengthen nursing and patient care. This project has important implications for culturally and ethnically diverse global society as promoting consistent evidence based perioperative training that can be applied across diverse healthcare teams. Standardizing orientation and skill validation ensures that all nurses, no matter their background, get the same clear guidance and support, creating an inclusive environment that encourages learning and professional growth. By strengthening preceptors and developing confident nurses, this project promotes culturally sensitive, patient focused care and improves outcomes for patients of all backgrounds. Additionally, it helps reduce variability in practice and potential biases in training, supporting more equitable care delivery. Ultimately, this approach strengthens a more cohesive and collaborative workforce that is better equipped to meet the needs of a diverse patient population. In this project, I acted as a leader by guiding the development and implementation of the standardized perioperative competency checklist. As a change agent, I identified gaps in orientation, introduced evidence based solutions, and promoted consistent training practices. As a member of the interprofessional team, I collaborated with preceptors, nurse leaders, and educators to gather feedback and ensure the project supported staff development and high quality care. These roles helped me create a culture where learning is encouraged, accountability is clear, and patient care in the perioperative setting is safe and reliable. This experience also strengthened my ability to communicate effectively across disciplines and adapt to feedback throughout the implementation process. It further reinforced the importance of strong leadership in driving sustainable practice changes and improving both staff confidence and patient outcomes. Throughout my graduate program, I developed advanced knowledge in leadership, evidence based practice, and organizational management, alongside skills in collaboration, critical thinking, and change implementation. These skills allowed me to create and implement the standardized perioperative competency checklist, providing a more organized and effective orientation process. Professionally, the project reinforced my commitment to scholarship, questioning, and innovation by applying research to solve a real world clinical challenge. Personally, the project emphasized the importance of lifelong learning, allowing me to reflect on my own growth as a nurse leader and change agent in the perioperative setting. Working in the OR myself, I experienced firsthand how a structured orientation helps the team work more smoothly and keeps patients safe, strengthening my commitment to ongoing learning, professional growth, and quality perioperative care. It also deepened my understanding of the impact strong mentorship and clear guidance can have on both staff development and patient outcomes. This experience will continue to shape my approach to leadership and my dedication to supporting others in their own professional growth. Based on the findings of this capstone project, it is recommended that the standardized perioperative competency checklist be fully implemented for all preceptor led orientations with ongoing training for preceptors and periodic updates to reflect best practices. Evidence shows that using structured, evidence based tools boosts preceptor confidence, promotes consistent skill assessment, and helps maintain patient safety. In conclusion, this project created a practical, evidence based tool that makes orientation smoother, helps preceptors grow, and ensures safe, effective perioperative care while giving the team a lasting framework for ongoing staff development. Moving forward, it will be important to keep checking in with staff to see how the checklist is working in real life and make improvements as needed. Using such a tool in other patient care areas could help create more consistency areas across the hospital. Ultimately, staying open to feedback and updates will make sure the checklist continues to support both nurses and patients in the best way possible. And here are my references.